Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nik Hamizan bin Saleh. My metric number is 11708588. So today I will present about In this video, I will present about the disease called kidney stone, which consists of definition, causes, the formation process of kidney stone, and also the symptoms. In the next subtopic, I will talk about current remediation in treatment and prevention of kidney stone disease. Next, I will focus on the new remediation technique by biotechnological approach. I will explain more about the application of microbial enzymes in the treatment of kidney stones, the source and type of enzymes involved, and also how it works based on the mechanism given later. In the last subtopic, I will cover the research and studies done for the enzyme application and development by biotechnological company in promoting this greener approach. And lastly, the conclusion of this video. So, are you ready? Let's go! So what is kidney stone? Kidney stone is the deposition of accumulated salt in the form of crystals that can develop anywhere along the urinary tract, which consists of kidneys, ureters, bladder, and urethra. There are many types of kidney stone that can form according to their specific content. The 5 major categories of kidney stone are calcium oxalate, calcium sulfate, struvite, uric acid, and cysteine. The most common kidney stone is calcium oxalate. So now we will focus on the most common kidney stone, which is calcium oxalate. So basically, calcium oxalate is the combination of calcium and oxalate ion. Oxalate, also known as oxalic acid, is a natural occurring compound in plants. High concentration of oxalate can be found in many plant-based food such as spinach, rhubarb, sweet potatoes, beans, nuts, tea, soy products, and even in chocolate. Oxalate can bind to other cations such as calcium, magnesium, and iron to form salt. So, if you eat a lot of food that contain oxalate, and at the same time, you also consume food with high salt content, the possibility of oxalate to stick with calcium are high and most probably will generate more oxalate salt in urinary tract. So, let's take a look at the formation of oxalate salt. In the digestive system, water and ions will be filtered and being absorbed into urinary tract through large intestine and then channeled to kidneys for further excretion process. In kidney, the formation of oxalate salt will occur where excess oxalate bind to calcium through a process called nucleation. The tiny crystal then will keep growing and aggregated with each other. The crystal will retain in the kidney for a certain period of time or may travel through the ureter. As this crystal might continue to grow, it will become more difficult to pass through the tract or the ureter. For worst cases, it will accumulate in certain area or even block the route. This will lead to more serious complications such as azotemia, hypocalcemia, and hemorrhage in the visceral organ. These are the symptoms when someone suffering kidney stone in their body. They will always feel nausea and vomiting often and might go for fever if serious. Besides, they will suffer pain in the back and the side of the abdomen and also at the groin area. Patient will have bloody urine, frequently urinates but in small quantity, and also will feel the burning sensation during urination. There are several methods used in the remediation of kidney stone. First, by using thiazide. Thiazide diuretic helps to prevent the calcium stones from forming. Next is allopurinol. Allopurinol will lower the level of uric acid in urine. Potassium alkali is used to make the urine less acidic. By performing lithotripsy, extracorporeal shockwave is used to break up large stones so they can pass down easily through the ureter into the bladder. Next, for the better prevention of kidney stones from forming, doctor always advise patients to practice healthy diet and increase the daily intake of fluids in order to smoothen the fluid stream and helps in diluting the crystal in urine. Last but not least, further surgery or ureteroscopy will be performed when there are too many stones formed in the urinary tract. How can we apply biotechnology in this issue? So, we can apply it by the utilization of microbial enzyme. As stated before, oxalate is one of the compounds that play a major role in forming kidney stone. Hence, this compound must be reduced or discarded from the urinary tract. So, the use of enzymes will help to degrade this compound. There are three main types of microbial enzymes that were reported for oxalate degradation. They are oxalate decarboxylase, oxalate oxidase, and oxalate-CoA decarboxylase. The bacteria that can produce this type of enzymes are Oxalobacter, Bacillus subtilis, and Lactobacillus. As human body are lack in producing enzyme for directly metabolizing oxalate, the external source of enzyme are needed and can be obtained through the consumption of probiotic food or medications containing oxalate-degrading microbes. The concept of using enzyme in this method is to degrade oxalate salt into smaller fractions and form carbon dioxide. Different enzymes used will give different yield. Based on the mechanism given, when oxalate decarboxylase is used, oxalate will degrade into formate and carbon dioxide. When oxalate oxidase is used, carbon dioxide and hydrogen peroxide will be produced. By applying oxalate-CoA decarboxylase, oxalate degrades into formyl-CoA and carbon dioxide. The development of new therapeutic strategies has become a necessity to contribute in preventing the formation of oxalate crystal. Vigorous research and studies about the utilization of microbial enzymes in the prevention and treatment of kidney stone has unexpectedly arisen. Findings and studies about this issue had also been reviewed by Shruti Gupta and Shamser Singh Kanwa in a journal named Microbial Enzymes, Role and Application in Industries. A biotechnology company has performed research and development about this therapeutic application of microbial enzymes. The company is Captozyme. The works are led by Dr. Qingshan Li, the co-founder and chief security officer of the company. So far, Captozyme has embraced an innovative approach in reducing the concentration of oxalate by developing enzyme products that help in degradation of oxalate. One of the developed enzyme from this organization is CZ2294. CZ2294 is an oxalate degrading enzyme that is highly stable in acidic environment, so it can function well for discarding oxalate in the stomach. Hence, the amount of oxalate absorbed in the intestine is reduced and lowering the risk of kidney stones formation in the urinary tract. Furthermore, Captozyme is also prepared to launch an anti-oxalate supplement and currently developing their own patented technology enzymes as therapeutic medication for more serious oxalate-induced disease in the future. In conclusion, the utilization of microbial enzymes for therapeutical application, especially in prevention of oxalate salt or kidney salt formation, has gained more attention and demand. In order to implement greener biotechnological approach in medicine or pharmaceutical field. My presentation has come to the end. Hope you like this video, and I hope that you get some knowledge and ideas based on the topic discussed. Stay safe, stay calm, and keep healthy. Assalamualaikum warahmatullahi wabarakatuh.